United Nations investigators discover multiple suspected mass grave sites in eastern Congo's Ituri province. In today's health segment, Africa 54's coverage of Africa Vaccination Week continues with an in-depth look at immunization. And what do you get when you cross a transformer with a car? We'll explain. Africa 54 starts right now.
Good evening and welcome. I'm Vincent McCory. This is Africa 54. We begin this evening with the United Nations investigators saying they have discovered 5 probable mass grave sites in eastern Congo's Ituri province, but they did not provide details about the suspected mass graves. At least 260 people were killed in the province when about 120 towns and villages were pillaged and destroyed between last December and mid-March. The report from the UN mission provides the most comprehensive picture to date of the human cost from months of brutal violence between Lendu pastoralists and Hema herders. Since December, the fighting has caused one of Africa's most serious refugee crises. Violence across eastern Congo's borderlands with Uganda, Rwanda and Burundi has spiked since President Joseph Kabila refused to step aside at the end of his mandate in 2016, eroding state authority and emboldening armed groups. In East Africa, 10 aid workers are missing in the South Sudanese town of Yei. The United Nations humanitarian coordinator for South Sudan says a convoy of UN and other aid workers were heading towards Tore from Yei in the central equatorial region early on Wednesday when they disappeared. This is the latest incident involving relief staff in the war-torn country. Aid workers are often targeted by armed groups operating in South Sudan since 2013. The United Nations has been in, the nation has been in conflict between supporters of President Salva Kiir and backers of his former deputy, Riek Machar. Tens of thousands of people, including nearly 100 relief workers, have been killed. Earlier this week, the International Red Cross said it had suspended operations in Lire after their field base was shot at on April the 10th. The National Human Rights Commission, in collaboration with the United Nations, is training government agencies in Nigeria's northeast to better tackle the humanitarian situation. A program held in Yola with the aim of providing training on how to better monitor and report the situation attracted participants from the Ministries of Health, Education and Justice. Freedom Houselon of Channels Television has this report.
For thousands of internally displaced persons in Nigeria's northeast, life in camps has been nothing short of challenging. Returning to their respective communities is not a bed of roses either, as many of them return to nothing. Majority of those displaced are picking up the pieces, but the humanitarian situation remains dire in most cases, given limited resources. The National Human Rights Commission, working closely with the United Nations Human Rights Commission, is organizing a capacity-building program for ministries, departments and agencies in the northeast. Drawing participants from the 3 most affected states of Borno, Yobe and Adamawa, the program seeks to enhance the response of government agencies to the needs of IDPs and returnees.
Over the last 3 years of implementing this project, it has become increasingly apparent that the Commission and its partner should bring on board other stakeholders in the protection sector to work together in order to achieve efficient response to humanitarian needs in Nigeria and particularly in the project states.
Both organizations are using the platform to engage and train personnel of government agencies who have the responsibility of providing protection, assistance to affected populations.
The National Human Rights Commission and the UNHCR is going to interface, engage, train you, and perhaps remind you of these very, very important roles that you need to play.
Knowledge is always continuous, and you have been very active in the humanitarian work in the 3 states. As of now in Nigeria, Borno, Yobe, and Adamawa, they are the main theater of the insurgency, though at a different stage. We are now talking of the returns And with the returns, there are other problems involved.
Promoting human rights is also a critical aspect of protection assistance. Security personnel at the event acknowledge areas in which they can better protect the rights of such vulnerable people.
Issues that has to do with IDPs' rights being trampled on, you know, the IDPs being falling into diverse kind of situation where they will need help, where they will need assistance and things like that, and where you could be able to talk to them and they feel a sort of belonging and part of the community.
The program is a key component of the IDP Returnee Protection Monitoring Commission, covering areas including identifying, measuring and analyzing risks and needs of affected communities, expediting response time and ensuring easy access to newly liberated areas.
Well, that report was by Freedom Haslon of Channels Television. Now, South African President Cyril Ramaphosa is expected to meet with his Labour Ministry to discuss the planned introduction of a national minimum wage. It's a policy which Ramaphosa, a former trade unionist, has championed. His meeting with Labour officials comes one day after nationwide protests over the proposed 20 rand in an hour minimum wage, that's about less than $2 in an hour, which protesters call starvation wages. They want the proposed wages scrapped and replaced with a living monthly wage that would be 3 times higher than their current wage. A new minimum wage was supposed to be introduced by May 1st, but that deadline's been delayed. Ramaphosa sees the minimum pay as an important first step to tackling labor instability and wage inequality in South Africa. Israel is abandoning a plan to forcibly deport thousands of African migrants who entered the country illegally. After failing to find a willing nation to take in the migrants, the plan collapsed when Rwanda backed out of a deal to receive the migrants, saying it could not guarantee their safety. About 37,000 African migrants received a reprieve after Israel canceled deportation orders that had left the community in limbo. On February, the government handed out papers to thousands of African males, which amounted to an ultimatum: leave the country in 2 months or go to prison. Most of the Africans came from war-torn Eritrea and Sudan. 2 migrants from Eritrea are now breathing a sigh of relief.
It was a difficult time that for the asylum seekers here in Israel on the matter of being deported or being imprisoned for a lifetime. And it's good news to hear that the forced deportation is cancelled. And also it's a time that there should be a humanitarian solution for the asylum seekers.
I am very happy to see the deportation policy is cancelled. And now it is the right time to the Israeli government to give a solution for the asylum seeker came from Africa, a refugee status, or to answer their asylum claim application.
The Israeli government says the migrants will again be able to renew residency permits every 60 days as they were before the deportation push. Libya has deported 169 migrants from Niger back to their homeland as part of a voluntary deportation program. The Niger nationals deported included 46 people who were held at a migrant detention center in Misrata and 123 migrants who were living with their families in the city. According to the head of Misrata's detention center, the voluntary deportation program is spearheaded by the United Nations International Organization for Migration in cooperation with Libyan authorities. Libyan detention centers are severely overcrowded, and the voluntary deportation is an attempt to remedy the situation. Libya is the most common departure point for migrants trying to reach Europe by sea. The U.S. Supreme Court heard oral arguments on the Trump administration's third attempt to implement a ban on travelers from some countries. Now, critics argue that the ban targets Muslims disproportionately. The government says the policy is needed for security reasons. Either way, for one young Washington family, it means a grandmother can't meet her daughter's first child. VOA's Victoria Machi has more.
At 8 months old, Della Abadi attended her first protest on a soggy morning outside the Supreme Court on Wednesday. She still hasn't met her grandmother in Iran.
They always plan to come here when I'm gonna have the baby and I get pregnant, but it didn't happen. It's the time that you really need your mom beside you, and it wasn't easy at all.
Politics keep the family apart. Relations between Tehran and Washington, regularly at odds, were dealt another blow under all three versions of the ban on travelers from some countries, including Iran, implemented by the Trump administration. The highest court in the United States heard arguments during an hour-long session on Wednesday from government attorneys and from the legal team that filed a lawsuit against the federal government over the third version of the travel restrictions, issued in September. Government lawyers argued Wednesday that the president is within his mandate to restrict some travelers and that the policy isn't discriminatory.
Protection of the nation from foreign terrorists.
The Trump administration says the ban is for national security reasons. But inside and outside the courtroom, there was little convincing opposition lawyers and protesters that the travel order is anything but a ban targeting Muslims.
I have no doubt that this policy is explicitly targeting Muslims, and it's rooted in anti-Muslim bigotry and hatred of Muslims from Donald Trump and other people in his administration.
The court is expected to issue its opinion on the case in June. Victoria Mackey, VOA News, Washington.
Well, I want to know what you think about Africa 54 and the stories we cover. Join the conversation on Facebook. The address is Africa 54. We're also streaming our show live on Facebook, so check us out and share our show with your friends also. And check out our headlines 24/7 on voaafrica.com. Find me on Twitter at VOA Vince McCory. Now, coming up, Africa Vaccination Week continues with an in-depth look at immunization. Stay with us.
Health news and notes. This is Living Better.
Heading for a trip on an airplane? You might want to book a seat next to a window as the safest place to sit to avoid catching another passenger's illness, says a new study from Emory University.
Only the people that are seated one row in front of that passenger, one row behind the passenger, and then 2 seats on either side in the same row as that passenger are really in what I would call a perimeter of risk.
Researcher Vicki Hertzberg, she says one reason a window seat is better for you is because it keeps you away from other possibly contagious passengers.
People who are in a window seat aren't being exposed to other passengers passing back and forth in the aisle.
Sitting in a window seat may help you avoid illness, but health researchers say frequent hand washing is still a key defense against germs. I'm Martin Seacrest for VOA's Living Better.
Well, it's time for a health report, and although she's a bit under the weather, joining us now is Africa 54 health correspondent Lino Mudu with more Africa Vaccination Week news. Hey, Lino.
That's right, Vincent. The 8th African Vaccination Week ends on Sunday, April 29th, as emphasis on world immunization is also ongoing. Experts say although great strides have been made in immunization over the year in low and middle income countries, much remains to be done to ensure that all children have access to key vaccines. Joining us now in the studio is Martha Rebour. She's Executive Director of the United Nations Foundation Shot at Life campaign. Martha, welcome to Africa 54.
Thank you. Thank you very much.
It's good to have you here. Also joining us live via Skype from Abuja, Nigeria, is Dr. Chikwe Ihekwezu. He's Chief Executive Officer of the Nigeria Center for Disease Control. Dr. Ihekwezu, thank you so much for joining us.
Thank you, and thank you for having me on your show.
It's great to have you. Listen, my question to you, Nigeria Centers for Disease Control does not necessarily lead primarily on vaccination. However, the agency works with another national agency to do so. Can you tell us about the type of collaboration between the two agencies and what type of support you provide them?
Yeah, so the Nigeria Center for Disease Control leads on all surveillance and public health laboratory diagnostics of the country. So, all our vaccine preventable diseases, in terms of actually counting the diseases, i.e. the surveillance systems to understand the burden of disease in our country and its distribution, organizing all the other prevention activities other than vaccination, ensuring that cases that are found can be diagnosed correctly. And so we support the National Primary Healthcare Development Agency with all the data on the actual diseases, while they then plan both routine vaccination and campaigns to address these diseases in our country.
Oh, great. And let me come to you, Martha. A Shot at Life is a campaign, a call for action to help children get more vaccination around the world. Can you tell us what it consists of and why it was so important to start such an initiative?
Yes, sure. So 1.5 million children a year die of vaccine-preventable diseases, and we think this is unacceptable. So Shot at Life was started to help decrease this the number of childhood deaths and to raise awareness around what a great investment vaccines are.
And Dr. Chikwe, you talked about the work that you do in terms of helping in the prevention of some diseases. We saw that in Nigeria last year. Even up until now, there have been an outbreak of meningitis. Okay, and meningitis is a vaccine-preventable disease. So what has been the main contributing factor in this outbreak that we've seen?
Yeah, so we had a fairly large meningitis outbreak last year. This year, the outbreak, we've responded a lot earlier, and we've managed to keep the case count much lower than last year. Now, the predominant strain for the outbreak we had last year and this year is meningitis C. Now, there is not a commonly available vaccine for meningitis C. The one that does exist is extremely expensive. So we're left with this specific strain to really scramble and bring in vaccines as we need to, supported by a WHO program called the ICG. So the vaccines that are available for this specific type of meningitis is simply too expensive to afford on the public health system. So what we are trying to do in Nigeria, while responding to outbreaks as they happen, through reactive vaccination campaigns led on by MPACDA, I think there's also a big international advocacy required to bring down the costs of these vaccines or develop vaccines that are more affordable to countries where diseases like meningitis and its various serogroups present. So while we're doing a lot of work to manage the local context, respond to these outbreaks, try and prevent them as much as possible, the most effective tool to prevent meningitis C outbreaks is a vaccine, and the currently available vaccine is simply out of reach of our public sector in Nigeria.
That's an interesting point that Dr. Chikwe raised about the access and the cost of the vaccine. And can you tell us, Martha, are there some specific vaccines that are being supported in the Shot at Life campaign?
Yes, sure.
Okay.
So we focus on 4 diseases. Polio and measles, because those are 2 diseases that we can actually eliminate in our lifetime. So in Africa, polio is only left endemic in Nigeria, in fact, and the other 2 countries are Afghanistan and Pakistan. And we focus on measles because until the year 2000, measles was the leading cause of death for children under 5. The global health community came together. Measles deaths were reduced by 84%. So we know when we come together as a global health community, we can tackle unnecessary deaths by these diseases. The other 2 diseases we focus on are rotavirus and pneumonia. And similar to meningitis C, historically, these are very expensive vaccines. They also happen to be the diseases are the 2 leading killers of children under 5 right now, which is why we focus on those diseases. There's a wonderful public-private partnership called Gavi, the Vaccine Alliance, which in fact, when the market wasn't working, Bill Gates and some other visionary leaders came together and said, we need to provide incentives for pharmaceutical companies to make these vaccines more affordable. So it's almost a wholesale Costco type model where when there's a guarantee to buy in such large bulk, so the pharmaceutical companies know that they have these guaranteed orders and can also have their facilities to be able to make these millions of vaccines. You have to change over your whole plant. Then they can offer them at a more affordable price. So countries such as the US and the UK, and as I said, the Gates Foundation come together and make a lot of these vaccines affordable, along with pharmaceutical companies. So that's a great example of a public-private partnership that's really working to increase access to, as we said, some of these vaccines otherwise would not be affordable for people in low-resource countries.
Yes, and Dr. Chikwe, I wanted you to react on polio. Martha mentioned polio. Where do things stand in terms of polio eradication and vaccine distribution?
So our sister agency, the National Primary Healthcare Development Agency, has worked extremely hard in the last 2 years since we had the last case in 2016, July 2016, and we have really pushed, extremely hard to cover most of the country with repeated vaccination campaigns. Thankfully, we haven't found a single case subsequently, and we really hope that this is really the end of polio in Africa, in Nigeria, obviously, and in Africa. Now, the challenge really post-elimination will be to sustain vaccination for as long as is necessary, but also now refocus attempts and our efforts at all the other vaccine-preventable diseases. And to do that, you really need an integrated response, including prevention, surveillance, laboratory capacity. And so we need to build out the infrastructure that we've developed for polio to really have a horizontal system with which we can address all the other vaccine preventable and also the non-vaccine preventable diseases. Because ultimately, our goal for all infectious diseases is to eventually have a vaccine. So as we use innovative mechanisms like was just mentioned, Gavi and the rest of them, to increase access to vaccines that are already available, we also kind of need to push very aggressively to develop new vaccines to diseases like Lassa fever in Nigeria currently, for which there's no currently available vaccine.
Yes, Lassa fever has no vaccine. So can you tell us what is being done? Where do things stand with the outbreak?
So we've managed we've had a consistent decline of cases for 6 weeks now. Last week we had a single case, so that's the lowest case count since the beginning of the outbreak in January. So across the country, we've really mobilized ourselves to respond to this. Now, Lassa is a very complex and very clever virus. It's well settled in our environment, has a very clever host, a specific type of rodent, and given the socioeconomic and population in Nigeria, it's not a very easy virus to deal with. However, I think we've learned a lot from this particular outbreak. Various professions have come together, from virologists, anthropologists, and we will use the knowledge that we have gained to prepare better for next year.
So Martha, let me ask you, with the Shot at Life campaign, how do people on the ground help implement this? What is the model in terms of implementation?
Yeah, thank you. That's a great question. So Shot at Life is part of the UN Foundation. So the UN Foundation is a nonprofit organization that supports the work of the UN. So Shot at Life is not actually on the ground. We work through our partners at UNICEF and WHO, who work very closely with ministries of health. So it's a very close collaboration. WHO tends to be more on the surveillance and laboratory side. UNICEF can be everything from the procurement to training of healthcare workers, depending on the specific situation of the country.
That's fantastic. And Dr. Chikwe, I will leave you the last word, given that we are getting ready to close. What are some of the lessons learned from the outbreaks, whether it's meningitis or Lassa, that perhaps the NCDC is taking in consideration to prevent future outbreaks very quickly?
So we've learned that a multi-sectoral, multidisciplinary approach is critical to dealing with the outbreaks that we're facing and infectious diseases in our communities. We have to learn about how societies work, which is why we're working increasingly with social scientists and anthropologists. We've got to learn from vaccine scientists. We've got to learn from public health epidemiologists and pool all this knowledge together in a consistent and coherent way to build the science led by Africans to deal with the diseases that primarily occur in our context. So it's by pooling together the various resources that are available to us.
Collaboration is key indeed. We have to leave it there, Dr. Chikwe. Thank you so much for joining us from Abuja. And Martha, thank you so much. It was a pleasure to have you.
My pleasure.
And that's Martha Ribu. She's Executive Director of the United Nations Foundation Shot at Life campaign. We also thank Dr. Chikwe Ihekwazu. He is Chief Executive Officer of the Nigeria Center for Disease Control. And that's our health report for today. To stay in touch, find me on Twitter at Lenore Mudu. Vincent, back to you.
Well, thank you very much, Lenore, and I'll be sure to watch Lenore Mudu's health reports every Tuesday and Thursday right here on Africa 54. And it's time now for a short break. Still to come on Africa 54, how Japan is turning our transformer dreams into reality. We'll be right back. Welcome back to Africa 54, and here's what's trending. Kanye West says that he has fired his manager and suggests that he may run for U.S. president in a frenetic Twitter spree in which he promised 4 new albums and spoke of his love for Donald Trump. West's tweets got a reaction from Trump, who tweeted back, "Thank you, Kanye, very cool." In the past 10 days, West has had a spate of Twitter posts, sometimes weighing in as often as 20 times an hour on wide-ranging themes. West was admitted to a psychiatric facility in Los Angeles in November 2016 and abruptly canceled the world tour after a week of no shows, curtailed concerts and political rants. He has since adopted a low public profile. And Japanese engineers have unveiled a robot that transforms into a car that can actually carry people on board in what they say is the first ever such accomplishment in the history of robots. The 3.7-meter tall two-seated robot can transform into a sports car in a process that takes about 1 minute. It can technically walk at a speed of 100 meters per hour or run on its 4 wheels, but developers say they have never really tested it outside the factory cargo bay area. They also say they will begin with utilizing the technology in entertainment industry, such as amusement parks and street parades. And that's what is trending today, and that's our show. Thanks for watching. Have a good night.
Welcome to English in a Minute. Liquid boils when it is heated to a certain temperature.
Boils down to this.
So Jonathan and Anna are probably talking about cooking. Or are they? I got a job offer.
That's great. Congratulations.
Thanks. But the job is in California. All my friends and family are here in DC.